Today we are going to learn about AI for enhancing healthcare accessibility. We will explore AI techniques that improve access to healthcare services in underserved regions and gain practical knowledge of deploying AI solutions to bridge healthcare service gaps. Welcome to today's exploration of AI for enhancing healthcare accessibility. In this video, we will delve into how artificial intelligence is revolutionizing the healthcare industry by improving access to services, particularly in underserved regions. Healthcare equity is a pressing issue worldwide, with disparities in service availability and quality starkly evident in many areas. AI offers promising solutions to bridge these gaps, making healthcare more accessible and equitable for all. Over the next 15 minutes, we will cover various AI technologies, including telemedicine, natural language processing, and machine learning, and discuss their implementation challenges and future opportunities. By the end of this video, you'll have a comprehensive understanding of how to deploy AI solutions effectively to improve healthcare accessibility.
Artificial intelligence has the transformative potential to address some of the most pressing challenges in healthcare accessibility. One of the primary ways AI contributes is by bridging the gap between rural and urban healthcare services. In many underserved regions, access to healthcare professionals and facilities is limited. AI can help overcome these barriers by facilitating remote diagnostics and consultations, ensuring that patients receive timely care regardless of their location. Additionally, AI applications in diagnostics, such as image analysis and predictive analytics, can enhance the accuracy and efficiency of medical assessments. This is particularly valuable in areas with a shortage of specialized medical personnel. AI also plays a crucial role in optimizing healthcare logistics, from managing patient data to streamlining the supply chain of medical resources. Furthermore, AI solutions often prove to be cost-effective, making them viable options for implementation in low-resource settings. Overall, AI's role in healthcare accessibility is multifaceted, offering innovative approaches to deliver quality healthcare to all.
Telemedicine has seen significant expansion in recent years, driven by the need for remote healthcare solutions. AI-powered telemedicine solutions are at the forefront of this transformation, enabling healthcare providers to extend their services to patients regardless of geographical boundaries. AI plays a critical role in remote patient monitoring, allowing for continuous health assessments and timely interventions. By integrating AI into telehealth platforms, healthcare providers can offer personalized care, leveraging data analytics to tailor treatments to individual patient needs. AI enhances patient consultations by providing doctors with predictive insights and automated support tools, improving diagnostic accuracy and treatment plans. This, in turn, enhances the quality of doctor-patient interactions, ensuring that consultations are as effective as in-person visits. Furthermore, AI-powered telemedicine can reduce the burden on healthcare systems by managing routine inquiries and administrative tasks, allowing medical professionals to focus on more complex cases. The integration of AI into telemedicine not only broadens access to healthcare but also elevates the standard of care provided. Natural language processing, NLP, is a branch of AI that focuses on the interaction between computers and human language. In healthcare, NLP is revolutionizing patient triage systems, making the process more efficient and accurate. By analyzing patient-reported symptoms and medical histories, NLP algorithms can prioritize cases based on urgency, ensuring that critical patients receive immediate attention. Automated symptom analysis helps emergency departments manage high volumes of cases without compromising service quality. In addition to improving triage accuracy, NLP enhances patient communication by providing real-time language translation services, making healthcare more accessible to non-native speakers. This is particularly important in multicultural societies or regions with diverse linguistic backgrounds. Moreover, NLP technologies can assist in gathering patient feedback and monitoring public health trends, providing valuable insights for healthcare providers and policymakers. The integration of NLP into patient triage systems not only optimizes emergency response but also fosters a patient-centered approach to healthcare delivery. Machine learning, ML, is a powerhouse of predictive analytics in healthcare, offering the ability to anticipate health events before they occur. By analyzing large datasets of patient information, ML algorithms can identify patterns and predict the likelihood of disease development. This capability is pivotal for early disease detection, allowing for timely interventions that can significantly improve patient outcomes. AI models enhance diagnostic accuracy by processing complex medical data quickly and consistently, reducing the likelihood of human error. Personalized treatment plans can be developed using ML insights, tailoring healthcare strategies to individual patient profiles for optimal results. Moreover, ML reduces diagnostic errors by providing healthcare professionals with data-driven support tools, ensuring that medical decisions are informed by the latest evidence. The application of machine learning and predictive health diagnostics not only improves patient care but also supports healthcare systems in managing resources more efficiently, ultimately contributing to better healthcare accessibility and equity.
Implementing AI solutions in low-resource settings presents a unique set of challenges that must be addressed to ensure successful adoption. Infrastructure limitations, such as unreliable internet connectivity and lack of access to modern medical equipment, can hinder the deployment of AI technologies. Additionally, the cost of implementing AI systems can be prohibitive for healthcare facilities with limited budgets. Training healthcare professionals to effectively use AI tools is another critical challenge, as it requires both time and resources. Furthermore, cultural and linguistic considerations must be taken into account to ensure that AI solutions are accessible and acceptable to local populations. This includes developing user-friendly interfaces and providing support in local languages. Sustainable implementation strategies are essential for overcoming these challenges, involving partnerships with local stakeholders and leveraging open-source AI technologies. By addressing these hurdles, AI can be successfully integrated into low-resource healthcare settings, enhancing accessibility and improving health outcomes. Data privacy and security are paramount in healthcare, especially as AI technologies become more integrated into medical practices. Protecting patient information is crucial to maintaining trust and ensuring compliance with regulatory standards, such as the Health Insurance Portability and Accountability Act, HIPAA, in the United States. AI systems must be designed with robust data security protocols to safeguard sensitive patient data against breaches and unauthorized access. This includes encryption, access controls, and regular security audits. As AI continues to evolve, it is essential to balance innovation with privacy, ensuring that data-driven insights do not compromise patient confidentiality. Regulatory compliance is an ongoing challenge, requiring healthcare providers to stay informed of legal requirements and adapt their practices accordingly. By prioritizing data privacy and security, healthcare organizations can harness the power of AI while protecting the rights and dignity of patients.
Several successful AI projects in global health have demonstrated the potential of technology to improve healthcare accessibility and outcomes. Notable examples include AI systems used for epidemic prediction and monitoring, such as those developed to track and respond to outbreaks of diseases like COVID-19 and Ebola. These systems analyze real-time data to predict the spread of infections, enabling timely interventions and resource allocation. In maternal health, AI-driven solutions have improved access to prenatal care in underserved regions, reducing maternal and infant mortality rates. AI has also been instrumental in public health initiatives, such as vaccination campaigns and health education programs, leveraging data analytics to target interventions effectively. Lessons learned from these successful implementations highlight the importance of collaboration between technology developers, healthcare providers, and local communities. By fostering partnerships and sharing knowledge, AI projects can be tailored to meet the specific needs of different populations, enhancing their impact and sustainability. The future of AI in healthcare equity holds immense promise, with emerging technologies poised to transform the delivery of medical services. Personalized medicine is one area where AI's potential is particularly exciting, offering the ability to tailor treatments to individual genetic profiles and lifestyles. This approach not only improves treatment efficacy but also reduces adverse effects, enhancing patient outcomes. AI is also set to play a significant role in mental health support, providing accessible and scalable solutions for psychological assessments and therapy. By leveraging AI to improve healthcare logistics, providers can optimize the supply chain of medical resources and streamline patient management, reducing costs and increasing efficiency. On a broader scale, AI has the potential to influence global health policy by providing data-driven insights that inform decision-making and resource allocation. As AI technologies continue to evolve, they offer new opportunities to address healthcare disparities and promote equity, ensuring that all individuals have access to the care they need.
In conclusion, AI has a significant role to play in enhancing healthcare accessibility and equity. Throughout this video, we've explored various AI applications, from telemedicine and natural language processing to machine learning and data security. Each of these technologies offers unique opportunities to bridge healthcare gaps, particularly in underserved regions. Key takeaways for successful implementation include addressing infrastructure challenges, prioritizing data privacy, and fostering collaboration between stakeholders. As we look to the future, AI's potential to transform healthcare is vast, offering new solutions for personalized medicine, mental health support, and global health policy. We encourage all stakeholders, from healthcare providers to policymakers, to embrace AI's potential and work together to create a more equitable healthcare landscape for all.